Hello and welcome to the Europas Tech Startup Awards and Conference. My name is Mike Butcher, the founder of the awards. And this year's theme is the continued impact of COVID-19 on the tech industry and the world at large. We're joined today by Dr. Ali Parsa, CEO and founder of Babylon Health, the health tech company founded in 2013 that's recently launched in the US to shake up the very complex healthcare system over there. And it's expected to float, in fact, in what will be one of the biggest flotations in 2021 via a merger with a SPAC entity. But before the whole SPAC thing, Babylon Health was already a unicorn. And of course, it's now going to be an even bigger one. So thanks very much, Ali, for joining the Europas Awards.
Thank you for having me, Mike.
And it's also, by the way, it's great that you're back after your 2018 win at the Europas for Health Tech Startup of the Year. So let's start with where Babylon is right now. You're about to become a public company via this $4.2 billion merger with a SPAC entity. But zooming out a little bit, what's Babylon to you today? What's the problem you're solving?
So the problem we're solving, it's a problem that any company in anywhere needs to solve, which is the value proposition for a customer. And if you think that in healthcare, value, like anywhere else, is quality over cost, and in healthcare, we express that as accessibility, affordability, and quality. That's fundamentally what everybody's trying to solve. In some countries like Europe, we are very good at affordability and quality. We have challenges with accessibility. In the United States, they're very good at accessibility and quality. They have challenges with affordability. And what we did in Babylon is to say that, hey, can you create an accessible, affordable, quality healthcare that we can put on the hands of every human being on earth? Can we do with healthcare what Google did with information? And that is fundamentally the journey we've been on.
Can you tell us a little bit more about how you view COVID-19's impact on healthcare? Like, how did it change things? There was obviously a big sort of movement to telemedicine. But do you think some of these changes that have happened during the pandemic will stick long term?
It's a very good question. And I think that the changes that the effect of the pandemic was twofold, if you wish. On one hand, it had a superficial effect, and on the other hand, a profound one. I think the superficial effect will absolutely last, but the profound one is where I hope we can really see the effect of the pandemic going forward. On superficial level, we all agreed that arguing on whether you can see your doctor or nurse or receive your healthcare on your mobile phone was a superficial argument. In reality, once we had to do it, we did it very quickly, and everybody saw their doctors and nurses on their mobile phone. So that movement, if you want, towards seeing people virtually, that will stay, and that is here to stay. I don't think there is any question about that. The bigger question, and by far more important question, is that can we change the way we deliver healthcare? Can we go from waiting for people to get sick to dealing with them before they hit emergencies and crises? That is by far a more profound effect that the pandemic had. If you remember, Mike, at the very beginning, we all waited for people to get into hospital and dealt with them. But very quickly, we found that our hospitals got overwhelmed and we couldn't do that. So we had to kind of try and keep people healthy by going through, in some countries, draconian measures to do so. The question is, that pandemic is not the only crisis we have. We have crisis of mental health, diabetes, chronic conditions in general, and our mode of operandi has been to wait for people to get super sick and then deal with that crisis. The question is, can we now learn from the pandemic and avoid doing that in future?
You talked about waiting for people to get sick, but is there a sort of a different kind of scenario where telemedicine can become a sort of a prevention mechanism as well?
So I think it really isn't about telemedicine. Telemedicine is a tool, right? In the same way that this conversation is not about whatever application we're using to deliver it. It is about digitization of healthcare. But digitization alone doesn't solve the problem, because all it does, it basically says that whatever I'm doing in the analog world, I go and do it in the digital world. So it's kind of, I use the example of Google. It's like Google saying, can I make libraries more efficient, or can I get everybody to talk to a librarian and then the librarian give them the information or whatever, right? They didn't solve the problem that way. They said, what is the fundamental thing that people are trying to achieve, which is access to information, and therefore, how could I make that more efficiently? And in healthcare, we need to do the same. We should not take the analog world and digitize it, but say that, well, how can we use the digital tools to fundamentally change the way the analog world had a problem with delivery of healthcare, and then deliver better model of healthcare. And I can talk to you about what I think that should be.
Moving to that model, wouldn't that require a very large shift in mentality, behavior for both providers and consumers? I mean, isn't that, are we talking about a kind of real sort of paradigm shift?
You're absolutely right, and we needed to. So I give you an example. If you in United States, dental insurance, a very simple example, right? Economically, not from a professional point of view, but economically, what does your dentist pray for? Your dentist will be praying the entire time for you to have a root canal so that they can get the $10,000 fees, right? Your insurance company will pay that fee, and that's that. Imagine now if your insurance company went to your dentist and said, hey, I get $1,000 from Mike for his dental insurance. My costs and profit is $150, so $850 is yours, and go deal with it. What would your dentist do? Your dentist will immediately try and find you wherever you are. They bring you back to do a full consultation with you. They do a full checkup. They try and figure out where the problems are and try to fix them before they become a crisis. And that way, they will avoid the root canal so that they can keep more of the economic profit by helping you stay healthy and your teeth to stay healthy. That's the profound change we need to have, to move from a fee-for-service, deal with crisis model to one that prevents and keep people healthy. You know, the industry we call healthcare, it really is not healthcare. It's a sick care industry. We wait for people to get sick, we fix it. We now need to truly invent the healthcare industry. And digital is a perfect tool to do that, because your dentist, well, and one person at a time, you can bring them, you can do the checkup, and you can do all of that. When you deal with millions of people, you need a far more scalable, efficient model of doing it, and digital can make it far more efficient.
So you touched a little bit on that that model that you're probably going to be looking at doing in the US. Can you tell a little bit more about your US plans? What's the business opportunity there? I mean, it's quite a complex system in the US, isn't it? I mean, and what's it going to be different to what you're doing in the UK? What are the implications for your business?
Well, look, we will fundamentally do the same thing we did in UK. UK, we didn't just do telemedicine. We were your primary care provider, which is a value-based care provider. The government gave us a certain amount of money to look after you end to end. And I tell you what, the reality was, for the cohort that we looked after, primarily in their, the average age was people in their 40s, they usually go to a doctor 2 to 3 times a year, and therefore we were getting paid to look after them 2 to 3 times a year. But because they had to often wait 2 to 3 weeks to see a doctor, then their usage was very low. And they were using doctors 2 to 3 times a year, as I said. What happened when we made it frictionless and took all the waiting time away and made it 24/7 was exactly what we thought would happen, which is people showed up 6 to 7 times a year, right? And that was really important, because what that meant was that we started losing a lot of money because we're getting paid to see people twice and they're showing up 6 times. But it allowed us to constantly automate, to optimize, to make it efficient, until to the point that last year we broke even, and currently we are breaking even on those patients. So we're getting paid to see them twice, we can see them 6 times. Much more importantly, what the NHS found out through its data was that our cohorts of patients became about up to 35% cheaper for them compared to other cohorts of patients. Obvious, if I give you complete access to a doctor all the time, you avoid your crisis, and therefore the chances of you having expensive treatments later is less, or going to emergencies less. So we took that very same model to United States. The only difference is that in the US, we can take the whole budget and therefore share those savings with the payers and with the patients.
But you touched a little bit on AI and artificial intelligence. Can you tell us a little bit more about how AI is solving these problems better? And there's obviously clear cost savings with that, but are there also potential pitfalls that you need to watch out for when employing AI in healthcare?
People might get too excited about artificial intelligence in the same way that people get too excited about self-driving cars. The reality is that if we agree that the right model of healthcare to make it accessible and affordable for everybody on earth, we need to, on one hand, make it much cheaper than it is. And considering all the costs in healthcare is in human resources, then we need to automate as much as possible, as I mentioned earlier. And AI is a tool for automation. Today does the very basic, and it allows us to almost deal with 40% of all our interactions with our patients to be almost entirely digitally. And through time, it becomes better and better. In the same way that a self-driving car has a lot of promise today, but still, and it can do greatly on track, but it can't drive really well in the cities. But the time will come that it will. So AI is something we invest in today, but we shouldn't get carried away by what it can do today. It's often, unfortunately, the journalists and the critics who on one hand pump it and on the other hand then accuse you of getting too excited about it. The truth of the matter is that as scientists or as practitioners, we just know that we just need to keep going until it becomes better and better. But when it does, it becomes an incredibly powerful tool. And to me, it's very interesting, Mike. Years ago, we used to get a huge amount of criticism for having chatbots to try and solve some of the patient's problems. Today, that's not a question. I mean, the NHS just announced that they're going to create their own triage chatbots, right? So you just need to blaze those trails and take it on the chin as people criticize you.
But also, you probably have noticed that people actually quite like having this access via an artificial intelligence platform because it's there for them 24/7. But what are the potentials for sometimes, wrong diagnosis, and how can you prevent that happening?
Huge. That's just the truth of the matter. That's why we tell people all the time ahead of using it that this is not a diagnostic tool, right? It really is just a better way of Googling your symptom. It's more, but you never rely on Googling something and say, okay, I now need to go and take this medicine. You just basically take it as a form of information. Our tool is very good, and it's actually biased towards safety, which make it, there's always a balance between safety and usability, if you wish. And then we make it more biased towards safety, which will make it less usable, if you want. But that's just the compromise one needs to make. But it's a triage. You should never take it as a diagnostic tool. And the real aim of it is to actually parse you on whether you should see a doctor or a nurse or a physiotherapist. So the most useful thing we get out of it is that in 63% of cases, it will tell our patients that they don't necessarily need to see a doctor, but a nurse will do a better job, or a physiotherapist or a pharmacist. And in 55% of cases or so, patients follow that advice. So most of our consultations at GP or GP practice for NHS now is with non-GPs chosen by our customers once they were given the information that why a pharmacist or a physiotherapist is better for them to talk to.
Right, yeah. So obviously it takes the load off GPs, but there are also legitimate concerns about things like privacy. And how do you feel that companies like your own are able to allay those concerns?
Look, those concerns are very real. Anytime you digitize anything that sits in any servers, they will be prone to criminal activities and people stealing it, so on and so forth. So we, and also, as you know, some internet companies, some giants in the internet world have made a business of selling people's data. And therefore, for good reasons, people are used to the concept for people are unfortunately used to seeing that their data has been sold. We never sell, never touch, never share a patient's data. A data of a patient for us is something that it's all about helping us to help them to stay healthier.
There has been some questions about how Babylon, becomes an interface between a patient and a GP practice. Could you explain for us what does it mean to have Babylon become your GP at hand in the way that it works, certainly in the UK?
So in the UK, we basically become your GP. So the way the contractual award in the UK works is that under NHS, you can only have one GP. So when we launched Babylon's GP service, 5,000 people a week were leaving their GPs to join Babylon. We saw those numbers are too high. As you remember, many GPs started worrying about the number of people that were leaving their practices. So we stopped completely advertising. So we haven't advertised almost for 2 years now. And we built almost by word of mouth entirely the largest single practice in primary care in UK with almost 100,000 patients. About 1,000 a week are now joining us by word of mouth. And the reason for that is that our service is 24/7, has almost near zero waiting time. And it's always available wherever you are in the world. You have your GP in your pocket. It's a better model of delivery in our hand. Now, if you happen to have a fantastic local GP who knows you, knows your family, and has been taking care of you all the time and is almost a member of your extended family, that's fantastic. Nobody will switch from that model to us. But that is not the reality for most people who live in London or Birmingham, the places that we operate. Many will have a need for a different kind of GP, in the same way that you and I sometimes stick to our local supermarket and sometimes shop at Amazon. It's a digital model for choosing how you get your help.
So you're still able to use your local GP, but you can also use Babylon, correct?
If you use Babylon privately, that's correct. If your insurance company has given it to you, that's correct. But if you want to choose Babylon as your NHS GP, then you switch out of your NHS GP into Babylon as your NHS GP. And then the government pays us your primary care budget, and it's our job to manage it for you. And we're just about, hopefully, to publish a peer-reviewed paper that showed that when we do that, when we become your GP, you are the 97% of the clinical quality outcome. You are over 90% of our patients give it a 5-star rating on how happy they are with it. Our churn rate is among the lowest in the entire NHS. And as importantly, the NHS saves up to 35% on the total cost of our patients. So everybody wins. The patients are happy, the NHS saves costs, and there seems to be a huge demand for it.
There's also a very interesting aspect of Babylon Health, which is your work in Rwanda, and you've done a very large-scale deployment there. Tell us a little bit about what you've done in Rwanda and what have you learnt in your operations there?
So after UK, when we figured out how to deliver the service, the next country we went to was Rwanda. And the reason we did that was our mission says making healthcare accessible, affordable, and putting it in the hands of every human being on earth. And that the easier answer would have been to go from UK to Germany or to France or to another rich country. But if you want to be true to your mission, you really have to go and solve it for a population that are fundamentally different. The cost of delivery for us to make it worthwhile in Rwanda should be around £1 a consultation, as opposed to what a telemedicine company in Europe gets, which is more like 30, 40 pounds a consultation or whatever it is. So we moved to Rwanda. I must say, I'm incredibly proud of the work the team does now. After 3-4 years of figuring out how to deliver, We now, last February, not this February, but February 2020, one of the proudest moments of Babylon was when His Excellency President Kagame gave Babylon a 10-year contract to provide free at the point of delivery universal primary care to the entire population who chooses to use Babylon. Today, we will do 6,000 consultations in Rwanda. That's a country of 10 million people, and we don't see children. So it's equivalent of, imagine, 5 million.
Looking forward, you know, Babylon was definitely a pioneer in the telemedicine world. But what sort of other things do you think could happen in the near future and longer term as well, beyond telemedicine, as it were? What other kinds of things do you foresee happening?
So I think what we are seeing in the world of healthcare is two fundamental trends. On one hand, we are seeing the fee-for-service sick care model being transformed across the globe to a value-based care healthcare model, whereby the payers pay the totality of the cost of a patient to a provider and ask that provider to then be responsible for keeping that patient healthy and avoiding the crises and emergencies. On the other hand, we are seeing a movement from analog to digitalization of healthcare. What Babylon does is bring these two together and try to create a value-based care but digital-first model of healthcare. And that is why when you look at value-based care companies in the United States, it usually has taken them 10 years to go from 0 to 30, 40, 50, the largest one, maybe 70, 80,000 patients. In 7 months in the United States, Babylon has went from 0 to 90,000 patients, and those numbers are continuing to grow really fast. We've demonstrated how you can make value-based care highly scalable, and that's what we will continue to do. We're trying to create an entire health system entirely virtually, in the same way that Amazon tried to create an entire retail system entirely virtually. It's a long journey. It will take us years more to do, but I'm delighted to say that I think that we are doing it better than most, and we will continue doing it.
Well, given that you just made allusions to what Amazon did, I'll be interested to see if you move into the space industry as well at some point in the future.
I don't think so.
But finally, I'd be interested to know, you're doing this big SPAC flotation, and obviously that's going to give you a big war chest, as it were. Can you give us any hints about what you might do next with Babylon with that power?
I just think that we will continue growing the business. Look, Mike, you mentioned that 2018 when you and I last spoke on this forum together. Since 2018, our valuation went up. If you invested in Babylon in 2018 versus now, I think you would have made, or maybe in 2017, 2016, you would have made 100 times your money, right? I mean, we've been growing. Last year we grew 5-fold. This year we will be growing 4-fold. And the money we are raising is just to keep that momentum. I mean, most companies, as you know, grow 40, 50%, and they're very happy. We're growing an order of magnitude faster than that. And we need the capital to keep up with the growth. So that's just keeping the ship steady as it goes. We don't need to do anything heroic. We just need to keep executing our plan.
Well, that's definitely the kind of talk that entrepreneurs normally have, keep executing. But for now, thank you very much, Dr. Ali Parsa, for joining the Europas Awards. Dr. Ali Parsa there, CEO and founder of Babylon Health. And I really appreciate you coming and joining us today. So thanks very much.
Thank you for having me. I really appreciate it.